Hello, everybody. My name is Danny Jimenez, and I'm excited that you are joining us today. Today, I'm so happy to bring you a unique story about a case we experienced here at the Clinics of David. Joining me today to help us chronicle one of our very challenging patient care situations at the Clinics of David is Dr. Marcello, the founder and medical director of the Clinics of David. Welcome, Dr. Marcello.
Thank you, Danny. It's a pleasure to be here. I look forward to sharing, hopefully, some insight about this very special case that we had here at the Clinics of David. And I hope that our audience can learn something and appreciate with a little bit more insight what we stand for and kind of work that we do here at the Clinics of David. Thank you, Danny.
2 years ago, a patient visited with you complaining of belly pain on the left lower side of her abdomen. You evaluated her, including an ultrasound, and you diagnosed her with PID, infection in the pelvis. You created a plan of treatment for her. You planned on giving her a shot of Rocephin, 250 milligrams, as well as azithromycin, 1 gram, weekly for 2 weeks. Please talk about the importance of your treating this patient considering her reproductive age.
Yes, Danny. So this condition occurs in about one eight women. The treatment plan is usually simple and straightforward. We always remind patients of their right to seek a second opinion. Look, the best thing about a clinic is that it's a clinic. No one can force you to get treatment. It's a partnership between the patient and myself, and we come up with a treatment plan that will solve the problem, but the patient has to become a partner in that endeavor as well. So these are serious infections that must be treated, and if they're not, then that's how people can develop complications.
But the patient failed to follow up for her treatment, despite efforts to reach her with phone calls, texts, emails, and letters repeatedly. The patient returned to the clinic about 5 months later, but with more severe pain. She described it as a pain of 10 out of 10. You evaluated her again, and this time the infection has progressed into her uterus. It required surgery, and when you got into her abdomen, the entire uterus and her tubes were soaking in pus. To save her life, you had to perform a hysterectomy immediately. Please talk about how her delay may have caused her to lose her reproductive capabilities at age 21.
Well, it was a very difficult situation, but it was a situation that called for action. Now, to her benefit, she already had two children at that time, so it would probably would have been even more difficult if she hadn't had any children. So I had counseled her before surgery that this was possible because I suspected, based on her assessment, that we're going to find pus in her organs. And we had discussed all the possible scenarios. So we had consent signed on her medical chart to proceed in whichever way we needed to, and so we did. It became a matter of saving her life at that time, and for me, that was the most important thing to consider. Um, in the middle of all that, you don't think about, what has happened in the past. If the patient was compliant or non-compliant, didn't show up for, follow-up visits or whatever, you just focus on, taking care of the problem at hand at that moment. And that is exactly, that was exactly my approach at that time.
Your patient was happy that you saved her life. I noticed you spoke to her more about moving forward with her life rather than on her mistake of not taking action earlier to get treated and avoid a near disaster. Please talk about that.
Yes, the silver lining, beats the dark past. That's the way the silver lining beats the dark past. And that's the way I look at it. Um, there's no reason, sitting there and celebrating the difficult past. I want to embrace the wonderful, present and future and then run with that. She did very well. And that's all that mattered to me. I only welcome, joy in these spaces, and that's what's better for the patient. I'm not there to deal with, anything about me. It's all about the patient at the time. And when your patient, um, you know, uh, has moved on, your patient needs, encouragement and support. Your patient is happy that we've got to a place where she can move forward with her life, and this threatening situation is behind her, and she's happy. You can't help but celebrate in that as well, and be happy for them, and inject that space with, positive energy, and move forward.
The patient has not missed a visit with you since that time. In fact, she has become an advocate for people to seek medical care sooner rather than later. She's referred a few patients to you, some who are her relatives and coworkers. Please talk about that, Dr. Marcel.
It's funny because you never know what's going to happen when you start a relationship with a patient. And so we had all this difficulty on the front end of the relationship, and here we are with this amazing outcome despite the difficulties. And I am very grateful to her kindness, that she has demonstrated to me since that time. The currency of medicine is trust, and she has demonstrated that to me, that she, her trust in me. And when your patients display that in you, it changes you, it humbles you, and it motivates you to become an even better doctor. But but at first you are humbled and grateful and thankful, for the trust that they have discovered to place in you. Because when you think about it, that's what it's all about. It's about the trust. It's about the relationship. It's about getting someone healed and then moving on in a new and better direction in their lives. And when you see that, and the person, is able to turn to you and recognize the small part you played in that, you're just grateful.
Thank you, Dr. Marcelo. And I thank you for reiterating the grave importance of people seeking the medical care they need before it's too late. Thank you, everybody, and God bless. I'm Danny Jimenez, your host, and I'll talk to you soon. Bye.